Hi, I'm Kayla Murphy, host of Your Health Matters. Today, we'll show you what to do with all those holiday turkey leftovers, take you through some core exercises you could do right at home, and Dr. Jeffrey Jones explains cardiac catheterization. And now, for some news from Meritus Health. For every soldier that's deployed to serve our country, a family is left behind. When Debbie Martz, medical assistant at Potomac Family Medicine, wife of a soldier and mother, heard that she could nominate her employer for an award for being supportive to her during that challenging time, she jumped at the chance. As a result of her nomination, Potomac Family Medicine was recently awarded the title of Patriotic Employer for employer support of the Guard and Reserve by the Office of the Secretary of Defense. This award included a certificate, medal, and flag.
It's a very long 16 months when, somebody that you're used to having there isn't there anymore. Mm-hmm. And so it was nice to know that I work in a place that will give that support and that care. And so that's why I figured I wanted to give Lou and everybody that recognition, because that doesn't happen that often.
Lou Miller, supervisor at Potomac Family Medicine, said her husband is retired military, so she understands what families in the military go through.
To me, it's important to support the military so that we can continue to enjoy the freedoms that this country now has. When you have staff members who have military ties, we need to show our support to them. When you have happy staff members, you're going to have a good company.
The Meritus Medical Center Auxiliary's 2011 Tree of Lights was illuminated December 4th in a ceremony held at Meritus Medical Center. The auxiliary undertakes the project each year to raise funds for projects throughout Meritus Health. This year, the funds raised are going to 3 different areas: purchasing a new modified barium swallow chair, and donating money to cardiac rehab department for patients who are under or uninsured, and the Meritus Healthcare Foundation toward the replacement of the 1999 wheelchair van used by Total Rehab Care. Community donors sponsor lights in honor of loved ones with contributions ranging from $10 to $500.
I wanted to honor my daughter Paige with a light on the tree. She was ill for 27 years and spent many, many days in the old hospital, and actually was in the move to the new hospital, and then she passed away in January. So I just wanted to remember her. We like to keep their memory alive, and it not only helps me that way, but I'm helping someone else with all the good work that they do with the money that they get from the donations. And I volunteer here now too, and I count that as a blessing.
Donations for the 2011 Tree of Lights are being accepted until December 31st by calling 301-790-8143. Did you know that many of Meritus Health's physician practices are now using electronic records? Dr. Tanya Kusaya from Williamsport Family Practice explains.
Hi, my name is Dr. Kusaya. I'm a family physician at Williamsport Family Practice in Williamsport, Maryland. I've been a family physician for about 4 years now and working at this practice at the same time. We are a part of Meritus Enterprises, and we've chosen Allscripts, where we have our primary care facilities along with several specialty clinics. We are actually linked with several other providers, both family practitioners. We have a general surgeon in our group, gastroenterologist, a general surgeon. So if our patients see one of those specialists, I have direct access into what that patient is being assessed for, tested for, and evaluated right by the access of my computer. So that helps immensely. All physicians are required to use the electronic record within the next few years, but we've joined earlier and can communicate with our own group better because of it. When referring to one of the providers in our system, it does have an advantage because I can see their records straight off. If they go to providers out of network or not within the Meritus system, then it needs to be delivered to us, scanned, and just an extra step. But I can still keep track pretty well. So I can directly put a request into one of our local gastroenterologists. When he sees the patient, he enters in a note that I can directly access. He can edit the medication list and the problem list as we share this one chart. So we're all in it together. Patients will notice differences on onset of the visit. So from registration to the end of the visit, they'll see changes. Their information is now entered more into the system on registration. They'll see the nurses plugging in vitals and the doctors putting in orders and assessments directly in. And even when they leave the office, they'll get a printout of a summary or even printout of their labs or prescriptions which is a whole different ball game than before. So I almost surprise a patient. They'll come in and they'll say, I saw my stomach doctor, and I'll say, yes, I knew already. They talked about this and that, and the patient will be surprised that I knew about it before I even got a letter or a call. One of the features that I like are the e-prescribing. Before we would handwrite a script, hand it to the patient, they'd go to their pharmacy, wait an hour, get their prescription. Now from the access of my computer, I can choose prescriptions to local pharmacies and mail-away companies, and with a click, send it out. It's easier on the patient, they don't lose scripts or misplace it, and it's a better record of documentation. This system also lets you see comparison so they can see how their blood sugars have ranged over the last few visits, and it's a nice visual addition. One of the questions that patients typically ask is the security of a system. They know that a paper chart is locked up in our office and safe. Our electronic health record is similar. There's a login to get out. You cannot access the system if you're out of our wireless network. If there are patients who would request a higher security on their chart, they just have to ask us. So for example, employers who are my patients can request that so their chart is more locked down and secure. Currently, we're still using a lot of paper as we transition, but eventually we're going to be pretty seamless and paperless. Prescriptions are going directly. Eventually lab slips will go directly to the lab. It's going to be a greener environment.
Here's an upcoming event to help you learn and improve your health. Do you want to quit smoking for the new year? Register for a free Beat the Pack smoking cessation class that begins January 12th and runs for 3 weeks from 12 to 1 p.m. each day. The class is held at the Robinwood Professional Center, Suite 122. To register, call 301-790-8907. And in case you missed it in our last show, we would like to share with you a video celebrating 1 year as Meritus Health.